Welcome to Health and Pharma. Today we have a special guest, Dr. Duggan, CEO of the International Pharmaceutical Federation, to discuss the role of the pharmacist in fight against the liver disease. Dr. Duggan, you are welcome.
Thank you so much. What an honor and a pleasure to be with you today.
If you want, we can start with some information about your professional journey and especially about the mission of the International Pharmaceutical Federation.
So, lovely. The International Pharmaceutical Federation is the global body for pharmacy, pharmaceutical sciences, and pharmaceutical education. We represent more than 4 million pharmacists, pharmaceutical scientists, and pharmaceutical educators around the world. The FIP vision is for a world where everyone benefits from access to safe, effective, quality and affordable medicines and health technologies, as well as from pharmaceutical care services provided by pharmacists, but also in collaboration with other healthcare professionals. Our mission is to support global health, including the area of liver disease, by enabling the advancement of pharmaceutical practice, sciences and education. My background is as a pharmacist. I graduated in the early 90s, and then I undertook a part-time PhD, which I did in practice. And I was particularly interested at that time to monitor mistakes or discrepancies between medicines that patients were prescribed in the hospital as they were leaving and then going into the community, to try and address all of this, essentially to get community and hospital to speak better. And this has held me in very good stead for my role as CEO here at FIP, because a lot of the care that, say, patients with liver disease need is about managing acute care in hospital, but also managing the prevention agenda and keeping them as well as possible out in the community.
Thank you. Could you explain why the liver health should be higher on global healthcare agenda?
I think it's very interesting when you think about other NCDs like cardiovascular disease or respiratory disease or even cancers, that we can trip off the tongue, but liver does not have a high profile, and we all need our livers. 1.5 billion people live with liver disease today, and that's a 13% increase since the start of this millennium, and it's responsible for 2 million deaths annually. So it's a very big health burden, as well as a terrible burden for individuals. There's more than 100 types of liver disease, and many are linked to common diseases such as diabetes and obesity. And despite clear trends, the focus or the awareness is just not there. There's a lack of awareness and focus on the common link between liver disease and comorbidities. So we think at FIP, and I think personally, by improving prevention and management, we can reduce the burden of liver disease on our health systems.
Well, considering the prevalence of the liver disease globally, how do you address the current level of the public awareness and education about this condition?
I think it links very much to your previous question, which is that not only is liver disease not a highest priority alongside all the other non-communicable diseases, but public awareness is very poor. Liver disease doesn't receive the necessary attention from governments, policymakers, and patients themselves who live with type 2 diabetes or a cardiovascular disease, or most clinicians and pharmacists. And we know that pharmacists can provide general information on maintaining liver health, such as the importance of a balanced diet, regular exercise, limiting alcohol consumption, avoiding risky behaviours that can lead to liver disease, such as unsafe drug use or unprotected sex. There are also awareness campaigns about liver disease, checkups, risk factors, symptoms, and all of these things can be promoted by pharmacists. And we as a profession can also perform initial screenings to identify individuals at high risk of liver disease. This might be as simple as assessing risk factors such as alcohol use or obesity or diabetes or family history. And pharmacists can recommend, facilitate and interpret liver function tests and provide referrals for more comprehensive assessments. So there's a lot that we can do as a profession.
How important is the monitor liver function in patient prescribed medication known for hepatic side effect and how do pharmacists get involved in this process?
This is really important because not only is liver disease very low awareness of the disease in our societies, but also I do believe patients and the public don't realise that most medicines that you take, particularly orally, are metabolised through the liver. So it's really important for pharmacists to play a huge role in ensuring patient safety. As a profession, we can counsel patients on the potential hepatotoxic effects of certain medicines, both prescription and non-prescription medicines. We can also help manage polypharmacy, so the taking of many medicines, which may all interact with each other, and we can minimise the risk of liver damage that way. It can be very important, depending on the patient and the risk related to a particular medicine. And if we can monitor patients on medicines that require regular liver function tests, for example, statins or methotrexate, to ensure early detection of the liver-related side effects, we can promote medication adherence to prevent complications. And we do this in other conditions, so it would be very easy for pharmacists to step into this role more widely.
Can you discuss the specific challenge faced in the prevention, diagnosis, and management of the liver disease today? How can pharmacists contribute to overcoming this challenge, particularly in terms of public awareness?
Many of these challenges stem from the original point we made about low public awareness, both about the disease itself and about the related services available. For example, pharmacists can administer vaccines for hepatitis A and B. Those are two preventable causes of liver disease. We can also educate patients about the importance of these vaccines and their place in managing liver disease. And another challenge is to make sure policymakers and health systems utilise our expertise and the availability of pharmacists in every community to improve access to care.
What strategy can pharmacists implement in enhance early detection of the liver diseases in community?
There's a lot of things that pharmacists can do. We can perform initial screenings to identify individuals at high risk, as I've mentioned, maybe addressing risk factors such as alcohol, obesity, diabetes, but also family history. But pharmacists can recommend, facilitate and interpret liver function tests and really use that evidence to provide referrals. Training pharmacists to recognise early symptoms of liver disease would enable us to advise patients to seek further medical evaluation. So really helping the patients to go with the facts in hand. And we can offer advice on weight management, healthy eating, all of these elements which are crucial in preventing non-alcoholic fatty liver disease. Pharmacists can also provide counselling and resources for alcohol reduction or cessation, including referral to support groups or even addiction services if that's necessary.
Could you elaborate on importance of the vaccination in liver health and how the pharmacist can facilitate this process?
Well, in a way, I think a lot of countries now know that pharmacists can get involved in vaccination. Pharmacy-based vaccination is now available in at least 56 countries, and pharmacists make a huge impact on immunisation coverage. But we need more pharmacists to be able to administer all vaccines, including those against hepatitis, not disease by disease, but all vaccines. According to recent data published this year, there are at least 19 countries where pharmacists can administer hepatitis B vaccines and 11 countries where they can prescribe the vaccine. But where we are not able yet to administer vaccines, we can contribute to educating the public on vaccination itself.
How significant is the role of the pharmacist in the medication review process to prevent potential liver complication? This is also very important in practical daily life.
Very important. I would say, and many would agree with me, pharmacists are the experts in medicines, and through reviews of medication, we can play a significant role in making sure patients are taking the medicines in the way that will result in optimal health outcomes. We, pharmacists, make sure that the medicinal products that have been prescribed are appropriate for the individual, that the patients adhere to the medication, any side effects are addressed, and that any drug interactions are avoided. And this pharmacy service is part of comprehensive care for all patients.
In the last question, How important is it for the patient with the pre-existing liver condition to consult pharmacists, and what should they discuss during this consideration?
It's very important for patients with pre-existing liver disease to come and discuss things with pharmacists. We're part of the healthcare team, integral to healthcare, and with the understanding of liver health and liver disease and medicines management, we can collaborate with other healthcare professionals in patient care. We're available to discuss and give advice on a wide range of topics, from medicines use to lifestyle modifications. It's recommended, for example, that anyone with an existing liver condition seeks advice of a pharmacist if they're thinking about starting a new medicine. And that includes over-the-counter medicines and treatments. When you have liver disease, it's really important that you don't just take things that might interact with what you're being prescribed, or that you take dietary supplements and herbal products without knowing the full facts of them. And the pharmacist will ensure that it's safe for the patient to do so. That's our role, about safety as well as access, and it's fundamental in patients with liver disease.
Well, thank you very much for this important information you share with us. I over my questions, but if you want to add something more or underline any message, I will be happy to learn about it.
Well, I think in summary, we need to do a lot with patients and the public about increasing awareness of liver disease. But from FIP's perspective, we need to do a lot about raising everyone's awareness of the pharmacist's role and contribution in prevention in every community, but also then in more specialist areas for patients and the public. So together, I think we can do a lot to help patients manage their liver disease, but also to keep people healthy before they even get a liver condition itself.